Next, we will hear from Bill Hoagland. Bill is a Senior Vice President at the Bipartisan Policy Center, helping to direct and manage fiscal, health, and economic policy analyses. Throughout his career, Bill has completed 33 years of federal government service, including 25 years on the U.S. Senate staff. He is also an affiliate professor of public policy at George Mason University. We're so grateful he's with us today to share how healthcare programs and services fit into overall federal spending. Bill? Bill, you're on mute. I think I can unmute you.
I'm unmuted, it says now.
Okay, now we hear you.
Okay, thank you. I apologize for that. Thank you for the Institute for the invitation to be with you this afternoon to talk about this issue of the federal budget and healthcare costs. It's always a difficult act to follow, Maya, and there may be a little bit of a duplication here. We'll leave it to the next panelist to really help us out on thinking about how to solve some of these problems that we're going to outline. First of all, the Bipartisan Policy Center, you should know, was established about 15 years ago by 4 former majority leaders of the United States Senate, the late Senator Bob Dole and the late Senator Howard Baker on the Republican side, Senator George Mitchell and Senator Tom Daschle on the Democratic side, all former majority leaders of the United States Senate, and all who came together to see if there were solutions, bipartisan solutions to the challenges that we face. I've asked to focus my comments on healthcare expenditures nationally, and then more specifically with a framework around the current federal budget. 3 topics I want to try to cover with you briefly. First of all, we talked a little bit about this already, national health expenditures and the recent projected growth there. I want to dig down, number 2, on makeup of the federal healthcare spending, particularly as it relates to what's referred to as mandatory and discretionary. Maya touched on that. And more importantly here, what's the impact of the Fiscal Responsibility Act means as we come to the end of the fiscal year here in the next 12 to 15 working days facing a potential government shutdown. There's going to be a lot of numbers, so bear with me. First of all, first slide, please. The first slide here, I just want to kind of get an exclamation mark on what my numbers are going down instead of up, but the same concept here. I just want to highlight the fact that the red line shows the projected deficit prior to COVID. And then you see on the blue line when COVID hit, yes, we had a major increase in the deficit as was expected, and as Maya said, understandably, the federal government had to intervene. But what I want to point out here is that blue line coming post-COVID, where we are today, is still even less than, deficit is even greater than it was pre-COVID going forward. Just to emphasize the fact that what Maya has indicated, that we are on a increasing path here. Next slide, please. In terms of just national healthcare expenditure growth over the last few years, if you look at 2020 there and not the shaded part there, that's government spending. We had a major increase in spending, a 10.3% increase in spending. The hash marks are out-of-pocket expenditures, third-party expenditures, does not include them. And what you see as we went into 21, following COVID, we actually had a reduction in the rate of growth in spending, and most of that had to do with the fact that all of the COVID spending, pandemic spending, was actually declined over that period of time. But as we go out into the future here, you can see that we're on a path that on national healthcare expenditures growing in that 5 to 6% range, going all the way out into the future. Important point as we come back. Next slide, please. What I wanted to take this national healthcare expenditures and highlight, and most of you are fairly, I'm sure, well familiar with most of these numbers. It's already highlighted. We're spending, at least in 2020, the fiscal year that we're in right now, or the, I think it's calendar year 2023, we're spending about $4.7 trillion. across the board, everything, federal, state, private. And the important first point I'd like to make about this chart here is that it's important to remind ourselves that if you add up the federal and state here, what you'll find is that this is truly a government and a private sector endeavor. Basically, about 50% of our national healthcare expenditures are government public expenditures. The other 50% are in the private sector. And so it's clearly a joint effort here in terms of what we're talking about when we're talking about controlling spending going forward. And while I don't know about this, they're all projections, of course, so I'm struck by the fact that as we go out into the near future here, I circled it there, the rate of growth in spending, it seems to be a little bit more at the state level, and we can come back to that, and Troy and the following panelists can maybe talk about it, but you'll see there. Also, the three major components of of national healthcare spending: hospitals, physicians, and drugs. And they make up about 2/3 of all federal spending. So if you're going to focus on controlling costs, let's be honest, you have to focus on at least those particular three major areas. And here again, I come back at small percentages, rates of growth make a big difference. And what you see there is hospitals, interestingly enough, at least in the projections from the Center for Medicare and Medicaid Management, it's not prescription drugs, it's hospital expenditures. And the per capita expenditures across the board here growing at about 4.7% going forward. That's the national picture. Let's go to the next slide, please. Maya touched upon this. When I look at all overall federal spending, I'll go over it real quickly here. Basically, it's Medicare, Medicaid. There are thousands of accounts in the federal budget. You can press your friends and neighbors and say, basically, you put all of the federal budget on one hand. It's Medicare, Medicaid, Social Security, and just paying the interest on our public debt, which represents about 14% by the year 2033 and growing. And add in defense. You can do all that in those 1, 2, 5 boxes there. That's basically the total amount of revenues that we can take in. So what you end up looking at is that little blue box to the right, and I'm going to come back to this very shortly, and that is what we call the domestic discretionary programs that make up about 12% of all federal spending. I'm going to focus on that in just a minute. So next slide, please. If we look at the issues associated going out, and these are projections admittedly, but for Medicare over the next decade, we're going to see from 23 to 33, we're seeing a growth in the neighborhood of about 7.6, offset by our offsetting receipts that come in to pay the taxes, the premium taxes that people pay. Medicaid's not the real dilemma here. It's 4%, but again, I keep coming back to the fact that it's Medicare is a major grower, a major factor in all total Medicaid, total healthcare programs, and major healthcare programs, what we call the mandatory programs that Maya talked about, are growing at about 6%. Next slide, please. This slide is trying to start to address one of these questions that came up earlier. Maya mentioned it in terms of the New York Times article about the drop-off in spending. If you look at Medicare average annual spending, it has come down in 2020 to about 3.6%. The differences here, it's not, I can't see the legend on this chart, but the legend here is that that shaded part is per beneficiary. The kind of the green part is just population growth. And what you see here is that we had a major reduction in per beneficiary cost in 2020 during the pandemic. It came back in 2021 and now is stabilizing at around about, as you can see, 3.1 going to 6%. It is the per beneficiary expenditures that we should be focusing on, because there's very little you can do about the fact that enrollment and population is going to continue to grow in that 2% range. That's Medicare. If we go to Medicaid, the next slide, same same legend. The population growth was exceedingly high, of course, during the pandemic, 4.8, and then 2021, a large increase in participation and expansion coverage. And now come off of that, of course, by the shutdown, the end of the declaration of the pandemic. And so we see that at least on Medicare, which bounces all over the place here, in 2024, you see a real drop in participation in Medicaid, but per beneficiary costs are in that 7 to 5% range going out into the future. Now let's turn to the next slide, which gets to I hope everybody can see. Unfortunately, you can't see the years here. What I am looking at is the what is referred to as this differentiation between mandatory spending and discretionary spending in healthcare. We've gone back and pulled out the various charts or various accounts in the federal budget and have added it all up. And what you see is mostly the growth in spending has been, as has already been emphasized a number of times already, that by the year that we're in right now, 2023, total federal spending for healthcare programs about $1.8 trillion, but almost all of that, 1.6 of it, is all in the area of the mandatory programs, that being basically Medicare and Medicaid. And that may be a good next slide, please, for me to highlight the. This is as a percentage of total healthcare spending, and once again, you can see on the red line here represents what we call the discretionary spending, which I want to talk about in maybe in our Q&A period. But it's important to note that you see the little bump out there, which you in year 20 in the pandemic years, but it's that the rate of growth is still in the mandatory as a percentage of GDP. So we're up above 6-8% of total spending, but most of that, again, of course, in the mandatory. So let's look at the breakdown of the next chart, please. The overall spending on those mandatory programs of that 1.6 trillion. It's basically, as Maya has already indicated, it's Medicare and Medicaid. That makes up about 87%. The other programs, such as children's health programs, insurance programs, CHIP, and all, they make up such a small part. So if you're focusing on spending, you're going to have to focus on those programs on the mandatory side. Next chart, please. But interestingly enough, for that 230 some billion dollars we spend annually in this year in 2023, where is that discretionary spending? That spending which is subject to annual appropriations and will be subject to potential shutdown here in a few weeks if we do not pass appropriation bills. Note that almost 50% of it is in one area, and that is veterans health. That's a discretionary program subject to annual appropriations. The other area here is it's a green area. You don't see the ledger on it, but the public health and social emergency services is about somewhere in the neighborhood of about 12.2 billion, or about 5%. And then you can see the breakdown: CDC, global health, administrative costs, HRSA, FDA. These are all critical healthcare institutions and agencies. But yes, even in the area of discretionary spending, most of it falls within the area of veterans hospitals and medical care. Let me shift now to the issue du jour, if you like, I guess, and that's the next slide. I hope we can, yes, good. What this chart shows here, it's a little messy, and bear with me. We had an agreement back in June, what we call the Fiscal Responsibility Act, FRA here. And what this chart shows you, it's important as it relates to the deliberations that are going on here in the next couple of weeks as to the funding levels. What you see here, we have an agreement that on what would and now we're talking about the discretionary budget. We're not talking about the mandatory programs. We're only talking about those programs that I had in the discretionary budget, total discretionary, not just healthcare, but all discretionary budget. That is defense. And you see for fiscal year 24, I circled it there, that the agreement was that defense would be at 886 billion. For non-defense, drop down to the lower panel, for fiscal year 24 would be $704 billion. And comparing those two numbers to what was actually funded for fiscal, would have been what we call on the baseline, what would have been funded without the agreement, you can see that there would have been a slight, very slight increase for defense by $2 billion, but for non-defense in those particular programs, I'm running out of time here. I apologize, just a couple of slides left. What this shows is that for that discretionary number, the non-defense discretionary, it is a reduction of about $112 billion from what would have been funded if we just kept this big bird on automatic pilot. If that, and that quite frankly, is what the appropriation committees are trying to do, is to put together, particularly in the Senate, bills that meet those caps, those specific numbers, 704 and 886, and particularly for the Senate. And if, however, we do not get the appropriation bills done by December 31st, then come next April, end of April, there will be what we call 1% cut, and so there'll be further reductions. This gets very messy, and I apologize for it. But interestingly enough, if we do not get all our bills done and we fall back to a 1% cut from the previous year's funding, which was 2023, there's a slight increase in spending for discretionary. In the interest of time, let me go to the next slide real quickly. And darn it, we're not going to be able to see the bottom line here, but the end point here is that the difference between in the far left column, the appropriation committees have been meeting in the Senate. They're moving very fastly in a bipartisan manner, not so in the House. And what they have is they're meeting that target of it's about $1.6 trillion for discretionary spending in 24. You can see about 195 billion of that is in that important committee called Labor, Health, and Human Services. However, in the House has chosen to not consider it a floor as the Senate has the agreement in the spring, but I guess I would call it a ceiling. We can go below it according to the House. And so their number, if you can see in the circle for that subcommittee, is 147. That's a $48 billion difference between the House and Senate going forward. Overall, adding it all up, it's about $120 billion difference between the House and Senate. This is what they're arguing about. This is what's going to be difficult to get an agreement on here. And I hope that we can avoid that. We can talk a little bit more about that as going forward. The last chart, I think, is the same chart that in some ways that Maya pointed out, and that is that by Social Security's trust fund, very dangerous, will deplete in 2033, while as the Medicare will deplete in 31. And I just would point out, if anybody, listeners online here, are under the age of and plan to take early retirement, if you're under the age of 52, then be prepared. If we did not address this issue both in Social Security and in Medicare in terms of the trust fund, then we're looking at, if you're under the age of 52, you're looking at about a 20% reduction in what you thought you were going to get in Social Security going forward. So with that, I'll put up the last slide and turn it over to our next speaker.